This is the third trimester ultrasound. Referred that the patient is not feeling any movements for the last few days. This is the head of the fetus, and you can see that the internal anatomy of the head is not in place. It is disturbed, except for that you can see CSPs and this fox cerebri. You can see these are the structures though seen within the center of the brain, with the cranium seen normal, and this is the fox cerebri. These are the thalami. This is the Sylvian fissure. However, this internal anatomy, the mental of the brain, is not seen as normal, and there is deviation from the normal regarding the anatomy of the brain. That is the reason I go on saying the more normal you see, the better you will go, the more easy it will be for you to get the anomaly at least. So here, from outer to inner surface, going through the broken fox, the BPD measures 8.6 centimeters, that corresponds to the gestational age of 34 weeks. Now, moving towards the femur length. That's because in the last trimester, at least at 34 weeks or above, we should try to get the gestational age by femur length rather than the BPD, because the head is really lowered down and you may get a false reading. Now this is the femur, and femur measures 6.8 centimeter, which corresponds to the gestational age of 35 weeks. Now this is the placenta, which is this is grade 3. You can see placental legs. This is the amniotic fluid around. These are the placental legs. These are the placental legs. Now this is the vertebral column. This is the vertebral column. It shows no anomaly. And here we will see the fetal body. This is the transverse section of the fetal body. First I will try to get you the normal. Now see, if you see, concentrate on this area, it's not giving a normal appearance. There is absolutely distortion of all the abdominal organs, if you see. But however, you can see this is the kidney. This is the kidney. This is the kidney in the fetal abdomen. This one, and these are the kidneys in transverse section. This one and this one. So now, don't see the urinary bladder is not visualized. This is the heart, and you see no fetal cardiac activity. You can do see the vessels arising from it, but there is no fetal cardiac activity whatsoever. This is the region of the heart. This is the heart. And these are the vessels emanating and entering into the heart. So this is a case for intrauterine fetal demise at 35 weeks gestational age. It's a recent demise because you saw that the skull was normal. There was no overlapping of the skull bone. Now this is the heart. This area is that of the heart. This one. And you see a blank line, no cardiac activity is seen. So this is the case of intrauterine fetal demise at 35 weeks gestational age. And if you see the internal anatomy of the abdomen, you will see that there is nothing more than these echoes, these tiny echogenic particles filling all of the abdomen of the fetus. So this is the transverse section, and you do not see any normal organ. The amniotic fluid is quite less. This is the only pocket of the amniotic fluid, this one, which is visualized. And this is the placenta. This is the neck. No movements. There is no movement that of the fetus. You don't see any limb movements. Now I will place the probe here, not move it, and you will see, except for the breathing of the mother, there is no movement that of the fetus. No respiratory movements even. So this is the case of intrauterine fetal demise at 35 weeks gestational age. So far, I was not able to see any activity or movement, respiratory in the fetus. Amniotic fluid is clear, there is no meconium, suggesting that the fetus was not in any distress before the mishap. The sentence posterior wall, you see. The placenta is posterior wall and right above the os. grade 3 placenta will appear as you are seeing in your picture now. Though basal densities are not that prominent, but this is how a grade 3 placenta appears on ultrasound. And see, note the clear fluid anterior to the amniotic fluid anterior to the placenta.